Well, let's talk about what many would say, whether they were conservative or liberal or whatever, was a radical agenda, and there were so many different pieces of legislation passed and signed into law that any two of them would have made a big session, but there were, more than 10 or 12. And they really affect a lot of people, as well as, quote, programs. Let's talk about Medicaid for a minute. A big part of the budget, I think 20 billion out of 70.
A little bit more, but yeah, almost 23 billion now.
What was the main concept? How did you, reform Medicaid in broad terms? What happened?
Well, first of all, in broad terms, it is a growing problem and growing and growing. As you know, with the new health care bill in Washington in 2014, the number of people on Medicaid will go from roughly 3 million, which we have today, out of almost 19 million, up to about 4.5 million, almost a 50% increase. We knew that that was unsustainable. So we did, starting last summer, we actually traveled the state. As you know, my wife's a medical doctor. She has a unique perspective. But more importantly, we're looking at hospital administrators. We're talking to people who are on Medicaid, the patients. That was the focus. So our goal was, first and foremost, try to have preventive care, so you're not going to the emergency room. The second point is put some accountability measures in play. I mean, taxpayers pay for this program, and it is a struggle to pay for it. We want people to be accountable if they're getting something for free, which Medicaid recipients are getting. And finally, by modernizing it, it allows us to save money with Medicaid so we can put more money towards education and transportation, let alone maybe lowering some taxes. Because with Medicaid being 1/3 of the entire budget, expected to grow under now the federal health care bill, we knew we had to reform it. But the focus was on the patient and being more accountable, and so we can have a system that will be viable for everyone.